Hi there, thanks for joining me in my Hogwarts nursery. If you're new to my channel, I'm Shanice Lowe and I'm a doctor of physical therapy and I'm expecting my first baby in just a couple days here. So today I wanted to talk about an issue that's really common during pregnancy, and that is back pain. So what is back pain? That can be any sort of discomfort in your upper, middle, lower back, and pelvic region. It's caused by a combination of changes during pregnancy, including altered posture, increased body weight, loosening of the pelvic and spinal ligaments, and hormonal changes. It can be described as sharp, dull, achy, or intermittent. Back pain during pregnancy is quite common. Anywhere between 50 to 80% of pregnant women experience back pain at some point during their pregnancy or postpartum. Normal back pain with pregnancy is not constant. It subsides or resolves with position changes. If your back pain is constant and unrelenting, it's not relieved by position changes, seek care from your doctor of physical therapy and/or your medical doctor for further evaluation. There are lots of things you can do to treat your back pain, including cold packs on the painful area or heating pads, or a combination of the two, whichever feels good to you. You can also try wearing an SIJ belt. That's a stretchy, tight belt that goes low around your waist. That will help to give you some extra external stability for your pelvis, but you only want to wear that during the active parts of your day. You do not want to sleep in an SIJ belt. That's not helpful. You also can perform strengthening exercises for the glutes, hamstrings, and deep abdominals in combination with stretching for the tight areas like the hip flexors and the paraspinals. See my mobility during pregnancy workout for some really helpful exercises that you can do. So how can we prevent back pain during pregnancy? You want to make sure that you've got stretching and strengthening as a part of your regular weekly routine, not something that you add in just when you're in pain. You want to keep doing it even when you're not having any issues. And you also want to make sure that you're consciously using proper body mechanics when you're doing things around the house throughout your day, such as bending and lifting, standing up from a chair, rolling and getting in and out of bed, making sure that you're keeping your spine safe when you're doing these activities. In general, you just want to think about engaging your deep abdominals when you're doing activities throughout the day, such as bending and lifting. That just means gently pulling your belly button in as you initiate that movement. That way you've got a little extra stability surrounding your spine when you go to perform that movement. And finally, some reminders for dealing with back pain during pregnancy. You want to make sure you're performing pregnancy-appropriate stretching and strengthening regularly, unless your physician advises otherwise. Use a cold pack or a heating pad on those painful spots. You can also try using an SIJ belt for the active part of your day. Focus on your form and body mechanics throughout the day as well to help with your back pain. My functional training workout video gives you some really good examples of proper form during lifting. And you can also see the video description for links to some of the pregnancy-specific workouts that I mentioned, as well as a link to my favorite SIJ belt. If you find this information helpful, please subscribe to my channel. And if you have any questions or comments, go ahead and comment below. Thank you so much for joining me, and I wish you the best on your pregnancy journey.